with that, I would like to invite our three presenters, as well as you, and you have been already very interested in posting questions. I would like to invite our three speakers to share their camera again, because now we came to probably the most interactive part of today, to have the chance asking a couple of practical questions directly to our panel, and you have been pretty interested in posting questions. And the first one I already have for Dr. Clayton. Dr. Clayton, how often do we need to check processing fluid or family processing fluids to confirm our Prrs status? Is it once a week or once a month? What is your recommendation?
Yeah, thank you, Dr. Marius. I would say that while we are trying to demonstrate stability, we should look once a week. Now, once we have accomplished those testing hurdles we talked about of 8 weeks in a row negative on processing fluids, followed by at least 4 weeks in a row negative on the family oral fluids, then traditionally we'll go to monthly for more of an ongoing monitoring program. But certainly during the elimination period, we would test weekly.
I see, yeah. And with processing fluids, you said you can aggregate up to 35 liters in one sample, right?
Correct, and still feel that your sensitivity is exceptional. One positive pig should show up in that litter or the 35-liter pool.
Mm-hmm. These are very practical informations, Dr. Clayton, because I remember one publication as this whole topic came up. There they recommended only to include 10 liters into one sample, but therefore it's very valuable that you share your practical insights with us, because including 35 liters will dramatically reduce the cost for diagnostics and sampling. Mm-hmm. And what does it mean if you have occasional Prrs PCR positive results in the piglet samples on serum and processing fluids from Prrs MLV vaccinated breeder herds? Does it mean that the Prrs MLV is not effective or not working? Or what can the results tell us?
Yeah, that's one of the most common questions I get from the farm. If we get a Prrs positive result, particularly one that's unexpected, we will sequence that result to determine if it is the vaccine strain or if it's the wild type strain. If it's the vaccine strain, we don't count that as a negative against the farm. So if it's simply the vaccine strain and we're using vaccine as a part of our elimination, we aren't surprised by that result. So we would still count that as being a good test for the farm. We found no wild type, and that's our goal at the end of the day. So we don't see that as a big problem. I would tell you that the one thing we might change is some farms may give the Prrs MLV vaccine to piglets pre-weaning, and we would stop that to try and minimize as much of the sequencing that we have to do. But other than that, we don't really get concerned or change anything we're doing based on just an MLV strain that we find on the sequence.
Mm-hmm. Okay, I see. Yeah, Dr. Oliver, our audience has been also very interested in your presentations, and we are not able to answer all of the questions. But just as a short reminder, please later on give us like a week or two, please. But then go to Prrs.com where you'll find all the answers for your questions. But don't wait for 2 weeks to go to Prrs.com. There's so much content already included that it's worth checking it out also meanwhile. Dr. Oliver, we hear a lot about Lineage 1 Prrs and understand that Engelbach Prrs MLV may not be a close match in terms of sequence homology. Can I trust that there will be a cross protection against my Prrs strains with Engelbach Prrs MLV?
Yeah, I think this is a good question to pick, Marius. It's a difficult question, number one, that's why it's a good one. No, the clarification first, it's important to distinguish between Lineage 1 and type 1. So just to make sure that nobody is getting confused, Lineage 1 is a way of describing the clades of the different genotypes. So within both type 1 and type 2, there's a vast classification of these viruses in these lineages. And as the dendrogram expands, we keep getting more and more of these clades, and it gets more and more confusing, I think, for practitioners, I think. But Lineage 1 is the dominant strain circulating in North America, and I believe in most of Asia too. Within that cross-protection map that I shared, there's a number of studies done with Lineage 1 strains. And so what we have seen, what we do is we continuously test our vaccine against new and emerging strains, mostly in North America, to be fair, but this gives us confidence that the vaccine is still working. And so you will see continuously studies done in the laboratory with these emerging strains. And of course, we want to be the first to find out if the vaccine is no longer providing protection, because this would obviously indicate that we need to either develop a new vaccine or understand that better. But currently, even though this is a vaccine that's been on the market for a long time, we have seen in the respiratory model, which is what we mostly test, continued efficacy. And I think it even surprises us sometimes, but the results are positive. But as genetic differences get bigger and bigger, who knows, right? So we need to keep watching this space. But our experience is that while we don't get neutralizing immunity, we can control the clinical and economic impacts of PRRS. And I think that's an important point to make. If you read the literature, particularly the type 1 literature, viremia is the main parameter, right? And look, many of these challenges, you continue to see viremia for some time following the challenge. So viremia is an important virological parameter, but it doesn't necessarily mean that the vaccine did not give you a clinical benefit. And that's maybe an important distinction.
Thank you, Alba. And thank you for clarifying that Lineage 1 is not similar to a PRRS type 1. So if I am a farmer and if I am located in America or in Asia and I am concerned about type 1 and type 2, and probably I even diagnose type 1 and type 2 in my farm, what would be your recommendation for me?
Yeah, I think to be honest, certainly in Korea, I think more and more in the US, and maybe Dr. Clayton can share with us, it is not unusual to find both type 1 and type 2 strains circulating in herds, right? Quite typically, the type 1 strain is, I'm not going to say silent, but it's much less dramatic clinically in these situations, and is often detected through routine monitoring and sequencing. And it's typically an issue when you're trying to stabilize a herd or even do an elimination. My advice currently, I mean, in many countries in the US, for example, in the US, there is no type 1 vaccine. So basically we have to use type 2 based PRRS MLV vaccines. And we do so successfully, as I shared in my presentation. In Europe, where we have a lot of farms that are type 1 only, our advice is to use a type 1 vaccine. In Asia, my advice would be to use a type 2 vaccine, because the weight of evidence suggests that these provide the broadest cross protection. They cover type 1 strains okay, and they cover type 2 strains better than the type 1 vaccines. And so the weight of evidence would suggest that a better option is to not mix both vaccines. There is not a lot of hard data on this. There is one study carried out in Europe where they vaccinated either with a single type 2 or type 1, or vaccinated the gilts with two, a type 1 and a type 2. And there was no production improvement or no benefit from using the combined vaccines. And there was no safety issues in that study, but on the other hand, there was no benefit. So you're better keeping a minimum number of strains in that herd. And I would not recommend either two different type 2s or a type 1 and a type 2. I would stick to a single vaccine to homogenize immunity in the herd.
Mm-hmm. Okay, and focus on probably the most virulent Prrs strain.
Right, and while type 1 can definitely cause disease, overall type 2 is a more severe beast.
Yeah, thank you. And I remember for the ones who know our podcast series, Meet the Expert, we had the pleasure to interview Professor Greg Stevenson, and Dr. Clayton, I'm sure you know him from the States. He's one of probably the brilliant pathologists I have ever met so far. And he's also a very entertaining guy. And he said to me, "Yes, Marius, but you in Europe, you only have to deal with the baby Prrs. Here in the States, we have to deal really with the hard stuff." Dr. Shishan, could you just share with us what would be the safest and best program interval in days between Prrs and classical swine fever vaccination?
Well, as I mentioned, and our internal study and still ongoing, and it's similar like if you have a 1 week interval, and basically you don't see the negative effect of any interference, and the study is rather comprehensive. We have a clinical and also pathological. Also, I take out some of those studies. And this is actually a surprising finding even to me. And for example, what I mentioned, and the commercial pigs, you have a significant level of maternal antibody already, but they stand out, and the Ingovac CSF can overcome for that. So all that said, I would say timing-wise, 1 week at the least, but you have to fit in your normal vaccination scheme. And what the study design here is to reflect a routine vaccination program in China. So for PRV, for CSF, and basically they would vaccinate it against these two at around 4 weeks. So assume if you vaccinated in China, Clayton, and as you know, and they would vaccinate pre-weaning, most likely 2 weeks. So that's the routine vaccination program we are looking at. At the 2 weeks of age, you vaccinate Prrs, and then another 2 weeks, and you would be pretty safe. But I need to just call your attention to this is the Ingovac Prrs. The last 10 years, we spent a lot of investment on a better Prrs vaccine. And in China, as you might also heard, some company, including an MNC company in China, come up with a fixed combo in between CSF and Prrs. Unfortunately, the Prrs vaccine used is the so-called HP Prrs derived. The safety is an issue. The combo vaccine they launched a couple years back, now it's gone. So what I'm mentioning here is the safety nature of the Prrs vaccine. That's the foremost important thing you need to pay attention. Otherwise, time won't matter. And in China, the field practice, and we actually released 3 or 4 different so-called HP Prrs based MLV, and now the market closed all those HP Prrs vaccine just because of safety concern and easier to revert to virulence, and they shall hold to the ASF vaccines they're using now. So again, long answer, short answer is you have to fit in your vaccination program and at least 1 week interval.
Thank you very much, Dr. Shishan. With that, my friends, I would like to close today's sessions. I hope you have a nice dinner, a nice breakfast, or a nice lunch coming up. And I will stay still in the call to collect the questions. So if you have identified, also from the discussion probably that was just going on, if you have identified a couple of more questions and about Prrs, you know, there's questions will never finish. Just please include them into the chat and I will collect them, and within the next couple of days we will include them into Prrs.com. And on Prrs.com, as I just told you, you will also find the podcast series, the interviews with Dr. Clayton Johnson, and you will shortly see the cross protection tool that Oliver just briefly shared, where we have one section dedicated specifically to co-infections with type 1 and type 2. With that, thank you very much for your attention. Thank you, speakers, for your valuable contribution. And I'm looking forward to seeing you all again next time. Thank you very much.
Thank you, everybody. Thank you, Marius.
Bye.